Well, now to that urgent new warning about that rare inflammatory syndrome linked to coronavirus. We've seen it mostly in children, but now some doctors say they are also seeing it in young adults in their mid-20s. Stephanie Ramos joins us with more on this story. Good morning, Stephanie.
Amy, good morning. While the overall number of COVID-19 patients has gone down in New York City and other states, the number of children and young adults with this inflammatory syndrome has not, many of them testing positive for COVID-19 antibodies, suggesting they may have been exposed to the virus weeks earlier.
This morning, several doctors are warning that the rare inflammatory syndrome linked to COVID-19 is not just affecting children, but also young adults.
We've actually had a number of individuals, particularly through the teenage years, but clearly into very young adulthood.
Young people ages 20 to 25 years old sick with the illness now reported in California and New York. Some medical experts warn the syndrome could present itself more seriously than it does in children, but it's still too early to know.
They may be more severe in this young adult population, both in terms of direct heart injury as well as a sort of blood vessel problem.
According to the CDC, symptoms of the multi-system inflammatory syndrome include fever, abdominal pain, neck pain, red eyes, and rash. In young children, parents should seek emergency care right away if their child has trouble breathing, bluish lips or face, pain or pressure in the chest that does not go away, or severe abdominal pain. The number of children with the syndrome is growing, spreading to 13 countries, and here in the U.S., cases reported in 25 states. New York Department of Health now investigating 157 cases in New York alone.
We don't know how widespread it is, but the more we look, the more we find it.
The COVID-related syndrome now raising concerns about schools reopening in the fall.
For young adults planning to return to colleges and universities, the CDC says the schools should recommend and reinforce the use of cloth face coverings, hold smaller classes in larger rooms, and check to make sure the room has proper ventilation. The CDC also notes that dorms should have physical barriers like plastic flexible screens between bathroom sinks and beds. Just some of the strategies listed on the site. Michael?
All right, thank you, Stephanie. We're going to bring in Dr. Jennifer Ashton to answer a few of our questions. And Doc, initially, they believe this multi-inflammatory syndrome only affected children. Are there theories as to why it's now occurring in young adults?
Well, Michael, right now, in terms of patients in their 20s, one of the theories is this picture we call infectious vasculitis. That's an inflammation of the blood vessels after or due to an infection, and particularly the blood vessels that feed the heart and the heart muscle, but potentially anywhere in the body. So right now, they're still connecting the dots on this picture, but most doctors who would treat these young patients in their 20s have never seen a case of Kawasaki syndrome because, again, remember, that usually happens in children.
Yeah, something new for everyone. And Doc, we also hear the first doses of a vaccine. It could be delivered by October, which is way ahead of schedule. What has changed in that?
So this is another contender, Michael. This comes from researchers at Oxford University in conjunction with the drug maker AstraZeneca. And the thinking and the hope is that they will be accelerating development and manufacturing of their vaccine, set to go into phase 3 clinical trials with 30,000 U.S. volunteers in the next couple of months. And the hope is that they can combine the steps, particularly those of manufacturing, at the same time as they do the research and the clinical trials, rather than do them one after the other. And when you talk about manufacturing, Michael, remember, hundreds of millions of doses potentially or more for the world with vials, stoppers, temperature controlled. It's a very specialized process.
Very specialized and a lot needed. Doc, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.